And can't thank you enough for letting me be a part of the conference today and to talk to you about this subject, parental substance abuse and the impact of youth. To give you a little bit of perspective, where I'm coming from this. So way back in 1995, right out of graduate school, my first job was I was hired as a family therapist for a 16-bed residential substance abuse treatment program for teenagers. So 16 chemically dependent teenagers that were all going to be in treatment for a year. And my job was to do 4 family therapy groups a week and all the individual family therapy. And at that point, I had done 2 family sessions in my life. So that was definitely a baptism by fire. But I loved it. I really enjoyed helping the kids and their families. But with that being said, the introduction of seeing the impact of parental substance use with their sons and daughters, really got a knowledge base of that firsthand that's informed me for my whole career. And I've always worked with teenagers for 25 plus years and families and adults struggling with substance use disorder. So a lot of what I'm going to be sharing with you guys is coming from that perspective of, providing services for youth, trying to help their parents and families and loved ones, and really kind of seeing what that's like. And I'm going to share some of that with you all as well. I'd be remiss without saying, though, and I know you all know this too, but parents are huge protective factors for kids. The research shows this, and a couple pieces here about an understanding that kids that grow up in a home where they see a parent, a parental figure, a guardian expressing disapproval about substances, they're much less likely to engage in it. Or if they do, they're much older by the time they do. So, one study I'm referencing here, marijuana use was much less prevalent among those kids who believed their parents would strongly disapprove of it, versus those kiddos who did not. I mean, 5% versus 32%, huge difference. So when people ask me a lot about, for kids, what's really a major protective factor, it is, who am I growing up around? What's their perception of harm? What's their perception of the view of substances? How is that talked about to them? So there can be some major differences there. When I think about the kids I've worked with, whether that was at Hillcrest Hall or, I came on board at the Ridge Behavioral Health in 2003 when they opened up a 28-day inpatient adolescent treatment program. And we had a family program with that. A high percentage of the family members that we worked with, we were also trying to get them help. Or part of what led to their son or daughter coming in with us was there was an issue in the home related to substances with a parent. So, really got to see that firsthand a lot. The importance of the protective factor there. And when you start talking about effects, those kiddos that grow up amongst substance use, they tend to be exposed to activities that will have a negative influence on them. So whether that is, being around substances, trafficking substances, other types of criminal type behavior, but really just an overall, there's a level of instability that's there. And if we're not careful, what can start to occur, those kids really start to pick up a lot of that and are influenced by that. And listen, that's not only what's happening in the home, but it can also branch out to, hey, what's happening next door, what's happening across the street, a neighborhood. It can impact a town, a city, a county, our state. I mean, you guys know, it was really good to hear that at lunch, some of the impact and what we're seeing happening in different counties. But, we would, in my career, lots of times I'm treating individuals where there's just been, generations of substance use issues. When you look at, Kentucky, some interesting statistics, April 2021, we had a little over 9,000 youth that were in foster care. And then you start kind of taking a step back from that as far as what influences that. Again, substance use plays a big role in that. Last year in Kentucky, we had over 38,000 CPS and CDV reports that met the criteria for investigation that totaled over almost 56,000 kids. And when you look at what was documented as a risk factor, substance use, close to half, of the time, was substantiated. So we know that influence can have such a significant impact on kids. And it would not be, I can think of so many cases where, here comes a 14, 15, 16-year-old that's coming into inpatient treatment. And part of that was fueled by a parent also struggling with substance use. And now, unfortunately, the home is being split up. Hopefully the parent is getting the help that they need. Their son or daughter is coming into care to get the help they need, and there can be a reunification. But, that's such a huge upheaval. And we're going to talk about trauma and the impact of trauma that can also influence the development of substance use disorder. And a lot of kids that I worked with definitely have a trauma history. According to the National Center on Addiction and Substance Use out of Columbia University, it's estimated 27 million children live with a parent that abuses or is dependent on alcohol or another substance in our country. 27 million. And when you really think about the impact of COVID and what we saw with that, Kentucky, we had made some really big strides in reducing overdose fatalities, 2018, 17, 18, 19. And then here came COVID, and it had such a negative impact. And last year across the country, over 108,000 overdose fatalities, the most we've ever had. Kentucky last year, over 2,000 fatalities. So the most we've ever had. So, the level of isolation, and that plays such a big role oftentimes with the substance use disorders, had a really big impact on individuals and kids and families as well. And we'll talk a little bit more about that. Children that are growing up around addiction, have a parent or a loved one that struggles with it, they are at a greater risk for the development of the depressive disorder, anxiety disorder, other types of mental health issues, definitely for a substance use disorder. We'll talk more about that. Another important aspect too is oftentimes they may not receive medical care that they need, because if somebody's under the influence of a parent, it's hard to really be on top of any type of medical thing they may be struggling with. So, oftentimes things that, should be treated are going untreated. Trauma comes into play because depending upon who's in the home, what's occurring in the home, people that are coming in and out, really chaotic home situations, it increases the risk of, physical, sexual, emotional abuse, other types of neglect and trauma that can occur. And just from the standpoint of, is it an environment that's going to be conducive for learning, for development and healthy development? And unfortunately, there can be times where it becomes a very negative influence that really impacts children's ability to learn, cognitive structuring that needs to occur to help with retaining information. So the research shows oftentimes kids that are growing up in an environment like that, they're going to struggle more with cognitive verbal skills, conceptual reasoning, abstract thinking, things of that nature. And it makes sense. I mean, a lot of the kids that I've worked with, their fight or flight may be on all the time. Is my parent under the influence? If not, if they are, what do I need to pay attention to? What might happen? What do I need to prepare for? And it's always, ping ponging back and forth. And it makes sense because that has a lot to do with survival and how we survive. So, but that also contributes to difficulties with mood and potentially, trauma that can occur as well. A lot of kids too, there's some strong emotions that come from, I have a loved one, I have a parent or parents that are struggling with a substance use disorder. There can be, guilt, there can be shame, and, oftentimes right up to blaming themselves, for what's going on at home. Unfortunately, I've worked with a lot of kids where, and again, this is somebody, with an active medical issue, in addiction, that may say things and do things that normally, not under the influence they wouldn't do, but it's causing harm, right up to, I've worked with kids where they've heard things like, you're the reason I drink. I wouldn't be depressed if it wasn't for you, and at age 8, 9, 13, what do you do with that? Kids, their brains are not programmed to understand, oh, wait a second, this is because my mother or my father has a substance use disorder and I shouldn't take that personally. That they are right up to, I've worked with a lot of kids where they get to a point where they really believe they can control their parents' substance use. If I just did this more or did that more or stop this, and we know they can't, but they really start to believe that. And that starts to come out, oftentimes schools, because, kids, heck, they'll spend more time at schools than they will at home. Those issues will start to present themselves, whether that's emotionally, behaviorally, in their performance at school, health problems that start to become more apparent. We would see kids that would come in and they would, start having issues with eating, eating disorders, but medically, it's not uncommon to see that there's going to be, issues that kids present with as well. Behaviorally, a lot of kids that are in a substance abusing home, they're going to be more likely to have problems in school, to be diagnosed with a learning disability. Again, so much of, understanding that when that kiddo completes a day of school, gets on the bus, goes home, gets dropped off, and what am I going to see when I open the door? What am I going to smell? What am I going to hear? What's going to be the impact? Is there anybody there? But not only just when I walk in, but what's the rest of the night going to be like? And what's the next morning going to be like? And that, over and over, day after day, has a pretty significant toll on kids. Children, adolescents, need structure. They need predictability. They need consistency. And that really helps with their overall development. They need to have a trusting relationship. And if it's really unpredictable, that's can have a pretty significant impact on kids. And with a substance use disorder, oftentimes it is unpredictable. Or I'll hear kids kind of talk about, you can pick up that it's predictable chaos. It's chaotic, but there's some predictability to it. They're more likely to miss school. We know a lot of kids, when you start to peel back who's truant and who's missing school, a parent mental health and or substance use disorder, may be at play there. There's a good chance. They're more likely to have to repeat, or they may transfer schools frequently. There may be moving that's going on, because of the erratic behavior of the parent that's struggling. More likely to have economic problems. And again, how this manifests itself. A lot of kids, and I think especially males, may tend to lean more toward frustration issues, irritability that can also lead to aggression. So, I've seen kids and helped kids that they may all of a sudden get a label of oppositional defiant disorder or conduct disorder, but really it's in relation to what am I experiencing at home and how am I handling it and how does it manifest itself? And when that gets addressed, when it becomes more predictable, stable, caring, some of that behavior oftentimes will change and will dissipate. And kids also, they may be more likely to come in contact with law enforcement as well. Additionally, kids may be more at risk for trauma. So, I can sit here and think of a lot of kids over the years that I worked with, that their trauma came from, what was going on in the home related to a parent's substance use disorder. And there was trafficking going on in the home. There was, really unpredictable behavior, aggression, violence, right up to even prostitution of the kid as well. So there's just such a risk because people are under the influence. They don't know what's occurring with their son or daughter, and some really significant trauma can occur. And not just, there's different types of trauma. And I know you guys are going to have a really good presentation about that after mine, I think. But, acute trauma, where there's a one-time traumatic episode. But a lot of kids that I've worked with over the years that grow up in a home where there's parental substance use, there tends to be more chronic trauma, which is repeated trauma but it's also complex trauma, which is trauma done to them by a loved one. So here's an individual that, I would look to for love, trust, understanding, and there's physical abuse or there's sexual abuse or, a family member that should be there in a protective role, and it's the opposite. And unfortunately, there's more of a risk with that. We talked a little bit about this, but child neglect is going to be much more highly associated with parental substance use, and the medical care piece. I can think back to, inpatient treatment and kids that were coming in, they were going to spend anywhere from 30 to 45 days with us. But upon admission, they would have a multitude of things that are going on, whether that was, flu, hepatitis, some type of injury. I can remember a kiddo that after 4 days of complaining over and over about their arm, we had an x-ray done. They'd had a broken arm for months that hadn't been treated. STDs, I mean, all kinds of different things that just, aren't being addressed because, the parent is struggling. The guardians are struggling with a substance use issue. A lot of kids that would come in when I mentioned to you working at Hillcrest Hall. So when I started there in 1995, it was a minimum of a year. So if you can imagine kids that, okay, they get admitted today and they're not going to complete until this day, 2023. And this is back, Polaroid cameras. So we would take a Polaroid of them during their assessment before we made the determination they'd be admitted. And that would go in their chart. So we would have that. And then on their graduation day, we would take another Polaroid picture. And the differences of seeing those two pictures from active substance use, really chaotic, harmful, to a year later after 3 meals a day, exercise program, weightlifting, you would see the kids cry when they would look at the difference of those pictures, and their family would, because it was just miraculous to see, adequate nutrition, care, support, everything else. They were different kids, when they left. And oftentimes the families were different too. And we had an opportunity to have a really positive impact on them as well. I can remember though, several kids that they would have the realization that if I go home, I won't make it. If I go home because of the substance use there, and they would end up going to Job Corps. And I can vividly remember 4 or 5 kids that I drove to the Frenchburg Job Corps, and they went there and thrived instead of going back home. Fetal alcohol syndrome, that risk also can play a role where kids, when there's parental, the mother is struggling with a substance use, alcoholism, and that's going to have a really significant impact on them, a lifelong impact typically. So the failure to thrive can also come into play, especially when there's substance use, prior to birth, and kids really can struggle with that. Now, that being said, the human body brain has amazing recuperative abilities, and kids that from birth receive great care, a lot of nurturing and support, can overcome a lot of issues, but that can be really, really difficult as well. So the medical impact, the educational impact, we talked a little bit about that. The problems at school that tend to come around, again, when that's going on at home and there's a lot of unpredictability, all of a sudden shifting into serious structure, 6 classes a day, organization, completing things, concentration, turning things in, kids will typically struggle. They'll have a much harder time. They'll get behind. They'll have difficulty. And a lot of that is, hey, how I'm feeling at school. I can't concentrate. I can't focus. I'm worried about things. I can think of several kids I've worked with where a lot of their anxiety was about, if I'm not at home, my father may overdose. If I'm not around them, who's going to be able to be there to make sure they're okay? So there's almost and we'll talk about this in a few minutes, a parentification that occurs with the child, for taking care of their parent. So, these kiddos that are in a home where there's a parent with a substance use disorder, their risk goes up to have more problems in, completing schoolwork, absenteeism, poor concentration, and really typically are going to struggle. Like when these kids would come into treatment, and now all of a sudden, hey, I'm in a safe environment, I've got a lot of help and assistance, they could really start to turn it around. And saw a number of them end up graduating from high school, getting their GED, and really doing well. But you could see the impact that was there. A lot of emotional consequences we're talking about, and that kind of gets into what are the feelings that a lot of kids have when they're, especially when they start to gain more understanding of what their mother or father, step parent, guardian, they're struggling with. So all of a sudden, here comes emotions and feelings like, mistrust, anger, confusion, fear, ambivalence, insecurity, a lot of anxiety, really significant emotional impact that on kids and what they start to experience. And that starts to manifest in things like panic, anxiety, kid, by the time they get to school or during school, they start to struggle, issues with eating, nutrition, more physical type issues. And then you get into, we'll talk some more about this, but, kids, and, you start to look at, when does substance use come into play for them? Well, just statistically in the United States, oftentimes 8th grade, 9th grade, here comes a potential introduction to a substance. And that's just what we see normally in our society. All of you all can Google Monitoring the Future survey. It's the largest survey we do every year in the United States related to drug and alcohol use. Typically, it's about 46,000 8th, 10th, and 12th graders. We ask them every question under the sun. Have you ever used this drug? Once, daily, weekly, monthly, your perception of harm of it, how easy is it to get? And that lets us look at trends. But 8th grade, you start to see, some of that come to light. And actually the more recent one, 8th graders' use of inhalants, amphetamines, and prescription cough syrup is the highest it's been in a number of years. We're starting to see this trend go up with our 8th graders of, using those substances where 10 years ago, we didn't see that, and that's concerning because, from a prevention standpoint, when we start thinking about, hey, who's really at risk, and it would be, you start to think about what's the influence behind that. What are they seeing? What are they exposed to? And of course, with these, it's really easy to be exposed to all kinds of things, but there's a decent percentage where there may be a parental influence involved there. Psychologically, those emotions that I was just sharing with you guys, you start to get into, psychologically, the impact that it has, where it can lead to, aggressive feelings, violence, unpredictability. Kids, in the beginning, especially when they're younger too, they're not aware that a parent may have this issue. They really may not understand, why is it at this period of the day, my mother or father acts one way, and then when it gets later, they're completely different. What the unpredictability of trying to figure that out, and that's really hard as far as, from a brain development standpoint for kids to, understand that and be able to safely, predict how a parent's going to interact with them. A lot of anxiety that comes from that. And conversely, parents oftentimes, there's such a risk of being under the influence that there may be violent behavior. There can be, emotional abuse that occurs. You look at especially parents that might be struggling with a methamphetamine use disorder. So the risk of violence, aggression, really serious issues increases very significantly. And kids are going to be traumatized from that. They're oftentimes going to really struggle. And an 8-year-old is not very verbal. A 6-year-old is not very verbal. It's difficult because unfortunately, a lot of problem solving is heavily linguistic based. So typically, what does that sound like? That's me looking at an 8-year-old and saying, tell me what's wrong. Well, that's me assuming that 8-year-old can internalize what I'm asking them, pull that up, form something with it, and regurgitate to me, here's what's wrong. And a lot of kids that young can't do that, even 12, 13-year-olds may struggle with that. And then as they get older too, there's also the risk of what happens if I share this information with you? I've worked with a lot of kids where part of that, trauma came from being told really bad things would happen if they shared information. If you tell anybody about this, you'll be taken out of the home. They'll remove your sister. You'll never see her again. Some pretty traumatic things that they've heard that unfortunately they're going to take very seriously and operate from that. Kids that grow up in homes where parents are struggling, there is a higher risk of developing an addiction for themselves. And I know you guys all know that, but I've seen that, the access to a substance is different. Now listen, that being said, okay, alcohol is in our society. Man, people can have a drink. There's nothing wrong with that. Glass of wine at dinner. A lot of kids grow up, they see that. Okay. But there's also a predictableness of behavior. There's not a negative impact. They don't experience that. That being said, there's a whole lot of kids that, as the parent's substance use changes, they may not be paying attention to access. They may not be paying attention to where their medication is. They may not be paying attention to other things. And unfortunately, in the United States, you really only have to open up a medicine cabinet to have access to all kinds of different things. It wasn't too long ago that here in Kentucky, okay, this is getting back to 2012, so maybe 10 years ago, for every 100 Kentuckians, there were 57 Xanax prescriptions. Okay, that's a written prescription from a provider. That's a lot of a benzodiazepine that's available. Okay, now that's changed, it's reduced, but that just kind of makes the point that there's a lot of availability oftentimes in homes without there even being necessarily an addiction, where kids, when they start to get certain ages, they explore and they want to figure things out and they want to see things and they hear things, and next thing you know, they can have access to something that's highly addictive. But marijuana use, if that's going on in the home, it just makes it so much easier for them to start. Cocaine use, methamphetamine use, it's right there. And at some point they're going to be tempted, right up to encouraged to, and all bets are off at that point. So and that gets into the environmental stress that comes along with when there's a parent that might really be struggling. Again, I've worked with a lot of kids. I'm in an outpatient environment now, and I'll see kids where the parent is struggling with alcoholism, but they may be, for the most part, functioning. They go to work every day, but there's some unpredictability at home sometimes. That they feel a certain way when they see their parent under the influence. And I'm starting to bring in the parent and talking that through to try to have an influence to get them to change. And you can see with that kiddo, some strong emotions, that might be guilt, might be shame, it might be frustration. Why can't I have friends over? Why can't I do some things? Why can't you take me here? Well, I'm under the influence, so it manifests in a lot of different ways. You all know, there's definitely a genetic predisposition to a development of a substance use disorder. Inevitably, I got a new client yesterday. He's functioning, adult male, okay, has an issue with drinking, would like to see that change, but it hasn't caused glaring problems. He's got a good job, home, everything else. But in asking the family history of that, father had alcoholism, he had an uncle that died of cirrhosis from alcoholism. There's definitely, he is predisposed that he can have 8 beers and 2 or 3 mixed drinks and function, and talk and everything. And, whereas a lot of people can't do that. their body just breaks it down. It's just completely different, So when I would see kids come into inpatient treatment or residential treatment, and you start to look at the family history, oftentimes, if not a parent that was struggling with an addiction as well, they had a grandparent or an aunt or an uncle that also had a history of addiction. And that just means their risk goes up. Kids that I think are in homes where, that history is there, because, hey, we all get dealt a hand with that. When a parent is very upfront and talks about that you are at greater risk, you need to understand, just like with, heart disease and diabetes and other things, you need to be aware that that's part of your family history, and you really need to pay attention to it, which gets into, don't start doing it. Don't risk it, of at some point triggering what could be the development of a substance use disorder. The environment, we've talked a little bit about that. Kids need that safe, predictable environment to develop. Unfortunately, when there is parental substance use, the atmosphere oftentimes does not have as much stability to it. And a lot of what's going on in the kiddo's life centers around what's happening with the parent and their substance use disorder. And unfortunately, there can be some really traumatic things that come from that. And kids start to get to a point where they're really frustrated with and upset with and angry and everything else because of how their parent is interacting with them, interacting with other people, not being available to support them in ways that they need, and can really have a negative impact on them. Lack of supervision is another area. And, when you think about what lends itself for kids and adolescents, teenagers to develop a substance use disorder, if there isn't supervision, if there isn't adequate, where are you? Time to be home, time to get some work done. How you doing in school? What's going on with your friends? Let me take a look at your phone. Let me have access and understand what's happening in your life. When that's not there, kids are going to do what they're going to do. And lots of times that gets into, they're going to explore, and they may be exposed to things. And if there's not that good structure and supervision, kids can really struggle, and you just kind of get into, especially as they age, and we're getting into, 14, 15, 16, 17, the exposure to certain substances increases significantly. The exposure to relationships and other negative aspects that can come along with in their life can really cause them to struggle if there isn't adequate supervision. So, that's one, for example, where, if a parent's under the influence, if they pass out, kids can sneak out, they can take off, they can bring people into the house. They can, I've had kids where, I can remember a couple where everybody figured out what happened once they stole their parents' car and they wrecked it. And then it was like, okay, here comes the police, here comes an investigation. They've been using substances. They've been taking drugs that, the parent had, and boy, now here comes this huge ordeal. And it all started with lack of supervision. I mean, that's what kind of tipped everybody off. So the routine and structure, oftentimes fades away, and that's where kids really start to struggle. I've worked with a lot of kids where, and you heard me kind of use that phrase before, where they become parentified, where lots of times they start to take over some of the household duties, right up to, I can think of several kids I work with where they were really raising their siblings. I can think of a 16-year-old girl that, she made sure that her two younger sisters got changed for school, ready for school. They got on the bus when they needed to. She packed their lunches. And lots of times that's because the parent was struggling. They were under the influence. They weren't at home, or they were passed out. And she got so stressed with that what happened? She started experimenting with substances and really started to struggle, and actually ended up having an overdose. And that's how she got on everybody's radar. So that's not uncommon, where, kids all of a sudden will even start taking care of the parent, make sure they get in bed, make sure they don't get sick, put out a cigarette, make sure, the house doesn't catch fire, all kinds of different things like that. And, there's not a regular system of how things go. So, a kid's kind of making this up on the fly, which is really stressful for them. A lot of studies reveal too that the children, of a parent that has a substance use disorder, they're more likely to be exposed to a non-parent caregiver. Okay, they're more likely to have other individuals in a caregiver role that may not be a family member, right up to, they could be in foster care, or they're with a grandparent, they're with an aunt, with an uncle. And that can be really challenging, for kids. Why am I not at home? Why is my parent choosing? I've heard a lot of kids, why are they choosing the drug over me? And that's difficult to explain to a 13-year-old, the understanding of a substance use disorder, and what addiction is. But boy, you talk about some really difficult emotions, and that can lead into some behavioral issues as well. So working in an inpatient psychiatric facility, I would see a good amount of kids that they would come in referred from foster care, or from a different treatment program, that are really struggling behaviorally, and you start to get into their history, and they've had parents that have struggled with substances. The unpredictability, I'm not at home, and man, they have such strong emotions about things that they can't control, and unfortunately, it's not their fault that a parent struggled with this, but they may be experiencing the consequences that come from it. I can't be at home. I can't have this normal life. And kids are going to struggle with that. So I can remember, oh gosh, this has to have been at least 15 years ago. And some of you guys have probably attended. At the time, it was called the Grandparents Raising Grandkids Conference. And it was maybe only like the first or second year. And they invited me to come to talk about substance use and what a substance use disorder is. And I got there, and there were probably maybe 60, 70, grandparents there, or family members. It was a really good event, a lot of great questions. Fast forward 10 years later, I was asked to come back and speak about a very specific topic. They wanted me to talk about kids with anxiety and how to help kids that develop anxiety. Okay. And when I got there that year, there were over 400 grandparents or family members in attendance. The significance of the opiate epidemic, fentanyl, heroin, and one of the most recent census data points, about 2.5 million grandparents raising 4.5 million kids in the United States. And I remember after that talk, several came up to me, with a similar, here they are in their 60s, 70s, 80s. I've adopted them because fill in the blank. Their mother died of a heroin overdose. Their father died of an overdose. They're incarcerated. There's trafficking. So they are in that caregiver role now, which is in itself such a unique situation to find yourself in. Of raising your son or daughter's child. So whether that is parental substance use, there can be neglect, incarceration, significant mental health issue. There's a lot of reasons behind why that happens. But one of the more common ones is related to parental substance use. Fortunately, here are family members that are able to be in that caregiver role, but it's stressful for them. Most of them did not picture I'm going to be back in this role, and here they are. You kind of picture this is what I'd be doing in my 60s, 70s, and it wouldn't be raising my 10-year-old grandchild. But that's where a lot of grandparents have found themselves. So what helping kids understand that a parent's substance use disorder is not their fault. Is really paramount, and it's extremely helpful for them. They didn't cause it, they weren't responsible for it. They can't control it, and there's a lot of strong emotions that come along with that. And especially younger kids, it's really harder for them to understand that. And again, sometimes a parent may even blame them for that, and that's in their active illness where that can occur. So, shame, which is probably the most toxic emotion we have. There's research that even shows, shame has a negative impact on our brain and brain functioning because of just the feeling that comes from it and how we experience that. So it's really paramount to help kids understand that, they didn't control this. They didn't make that happen. They don't have the ability to control it. And just as a child is powerless to stop it, the parent is powerless over their substance use as well, and that's difficult, and again, whether I'm working with a 8-year-old or a 18-year-old, there's a lot of strong emotions that come from, seeing their parents struggle with a substance use disorder. I've got a client I'm working with now. He's getting ready to start college. He's real excited about it. His mother has had alcoholism. She's actually doing well right now, but in her active illness, he remembered, at age 16, she had a relapse. And I remember, he said this, when that happened, I felt like we failed her. And he used that phrase, that I somehow failed her in not keeping her away from alcohol. Well, you can't, this is an adult, but that kind of really hits the mark on how a lot of kids will feel, responsibility in some way with that, or that they might be able to control it. So a lot of kids, they're at a higher risk for exposure to trauma. So I'd be remiss without at least talking a little bit about this. And it, especially because it's becoming more and more common in our country that kids are going to be exposed to some adverse childhood experience in their life. Sometimes multiple adverse childhood experiences, parental substance use, parental incarceration, untreated mental health issues, divorce. There's a lot of things that unfortunately kids may be exposed to that, again, some kids, it will have a certain impact and they'll handle it a certain way, and it might not be experienced as severely. Others, it will be traumatic for them. And that's important that we always keep that in mind. About 25% of all kids in the United States will experience a traumatic event by the age of 16. So 1/4, by age 16, will experience physical, sexual, emotional abuse. They'll witness domestic violence. They'll be assaulted. Some type of neglect, loss of a parent. With COVID, and then also the opiate epidemic, so many kids have lost a parent, lost a loved one. And a lot of them have had multiple experiences of trauma, more like the chronic and complex trauma that I mentioned to you all before. And it's, when you start to think about different levels of care, so kids that show up for an outpatient environment like where I am, intensive outpatient treatment, partial hospitalization, inpatient treatment, typically as the intensity of the treatment gets higher, they tend to have experienced more trauma. Their risk has gone up too. And I used to see that in more intensive levels of care as well. So kids that experience trauma, what are some things that we want to keep in mind with that? Well, it's not uncommon that traumatized kids will dissociate. They will experience a feeling of detachment, as if they're kind of observing things outside of themselves. If I'm growing up in an invalidating environment where my needs aren't met, where it's not, as predictable, consistent, my fight or flight is on all the time, there's a higher risk that they may experience that. Behavioral control, oftentimes traumatized kids can show poor impulse control. They can be self-destructive. They can be aggressive. That may look like oppositional defiant. That may look like conduct disorder. No, they're a trauma survivor. Okay. Cognition, traumatized kids, they can have problems focusing on and completing tasks, planning for and anticipating events, learning difficult. That can look like ADHD, but really it's trauma, that they've experienced. They may suffer from disturbed body image, low self-esteem, shame, guilt. That can look like depression and may be depression, but it can also be trauma. Attachment, kids, and how I've described to you, a lot of them, the world is very uncertain. It's unpredictable. They didn't perhaps have a healthy attachment with a parent because of their struggles with substance use. So they may be much more socially isolated. They can have difficulty relating to and empathizing with others. So that can look like different mental health issues. but again, may be the trauma. A lot of kids that have experienced it, that they'll have problems with movement and sensation, hypersensitivity to physical contact, and sensitivity to pain. That can look like different things. Mood regulation, that can look like bipolar disorder, because they're having a difficult time regulating their emotions. But at the end of the day, that can really be from the trauma that they've experienced. So that's why, the sooner that kids that are struggling are identified, the sooner that they can receive some type of an assessment to look at, from a mental health standpoint, substance use, a family standpoint, what they're experiencing, and some type of intervention can occur. We can mitigate some of the risk and reduce that, and also the negative impact it can have. Earlier there's identification, the better, for sure. Because we know, long-term effects of it. People that have experienced multiple traumatic episodes, they're much more likely to engage in high-risk behavior. And that gets into things like alcohol and drug use, depression, suicidality. I mean, everything from STDs to cancer, chronic lung disease, the risk just goes up pretty significantly. So the connection between trauma and substance use, let's talk a little bit about that. You heard me mention just even 8th graders and even younger, especially those kids that have more access or are growing up in a home environment where there's substance use, and trafficking and other things like that. The risk of, trauma goes up significantly. And when you already have, statistically speaking, 1 in 5 teenagers between the ages of 12 and 17 will meet the diagnostic criteria for a substance use disorder. When you take a look at, just our seniors, and the fact that, 55% of them last year used marijuana in some form, okay, at least once, you start to pare that down to getting down into the daily users and, what's going on with them. It's not uncommon to see either a co-occurring mental health issue or trauma that they've experienced. So we know statistically, looking at research, individuals that meet the criteria for post-traumatic stress disorder, about 60% of them have a substance use disorder as well. So it's not uncommon. Hey, how am I going to cope with how I'm feeling? Well, that's the thing. A drink, a shot of alcohol, a bourbon, 5 or 6 hits off a joint, inhaling cocaine. These are things that have big impact with hardly any time. And, for that individual, it relieves what they're struggling with. And boy, now we're setting things up to develop a substance use disorder rather quickly. Kids especially can do that in a couple of months. I mean, it doesn't take a long time for them to go from first use, experimentation, regular use, more of an addictive pattern in a very short period of time compared to adults, just because, from a brain development standpoint and life development. So, people that experience trauma can also quickly progress from, dabbling in it, weekend, recreational, occasional, serious, substance use disorder criteria. And a lot of that starts with, this is going to ease my distress. This is going to make me feel calmer, make me feel less anxious. And in that light, it works, but unfortunately it really influences the potential of developing a substance use disorder. So, let's get in front of somebody for an assessment. We always want to make sure that we are assessing for trauma and physical, sexual, emotional abuse, neglect, and substance use is really important. The more sources of information we can get, the better. So, obviously talking to the child is important. Talking to the parent is really important. But do I have access to other family members, caregivers, treatment providers, other people, school folks? Huge piece of the puzzle. School counselors and family resource center folks can really be helpful, because again, oftentimes there's a lot of diverse clinical problems that may be occurring, and it's hard sometimes to pinpoint what may be causing this. I was doing a training this summer. I've done several for school counselors this summer, and hearing them talk about what they noticed last year, with the impact of parental substance use, right up to, here comes a car pulling up to pick up a kiddo, and man, marijuana is just wafting out of the car, and they're calling police right there. I mean, here's a parent that is under the influence coming to pick their child up from school. And obviously their substance use disorder is just really out of control. The fact that I'm not even seeing that, yeah, this may, cause some red flags, but, I had several school counselors talk to me about that this summer, that they experienced that last year. So what are some other things we want to keep in mind as far as treatment? Tap into protective factors. So the more I can get kids involved in school supports, that's huge. Whether that's before school, during school, after school, any type of treatment or support groups they have. A lot of schools have some great resources for prevention that's really helpful, or early intervention. So really focusing on that. I'll talk to families a lot about that. Faith-based supports. Getting kids exposed to other adults in a mentoring role is really helpful. Sometimes, critical. And kids lots of times do well with coaches, instructors, people that are in that role. Music, art supports, art therapy, experiential type interventions can be really helpful for kids. Other support groups that might be available. Outpatient counseling, one of the best things we can do is have for that child or children somebody I can come to regularly, that the only dog they have in the race is to help me feel better, to listen, to validate with genuineness and empathy, that likes working with kids and is good at it. Okay. And boy, if you can get somebody like that in a kid's life that, is struggling with a parent that has that's really helpful for them. Especially when, and we're going to talk about this, a lot of kids are going to end up experiencing losses, loss of a parent, loss of an aunt, uncle, a sibling, somebody else related to their substance use disorder. So psychiatric care may be warranted. Higher levels of care may also be warranted as well, right up to inpatient, services, especially for those kids that, really start to struggle with a mood disorder, post-traumatic stress disorder, and or a substance use disorder. Teach the 7 C's. I like this. According to the National Association for Children of Alcoholics, children need to know the 7 C's of addiction. I didn't cause it. Okay. I can't cure it. I can't control it. I can care for myself. So let's get control back. Okay. And I can care for myself by communicating how I feel, what I'm thinking, making healthy choices, and by celebrating myself. When kids, understand this more, and there's other people in their life that will support this, that will nurture them around that, they will handle it much better. That resiliency will come out, and they'll thrive despite what may be going on, with their loved one, with their parent. And I want to touch on this. I know we're getting close on time here, but when a child loses a parent, obviously one of the most painful things that anybody can experience, the loss of a loved one. But for a child especially, kids are extremely resilient, but they need a lot of services at that point, a lot of support, and we can help them recover from that. Last year in Kentucky, we had over 2,000 overdose fatalities. Many of those individuals were parents. They were individuals that were in a caregiving role. So there's some support groups that have developed for kids, grief support groups that have lost parents that are really helpful. I know Lexington has a couple that kids can be referred to, also through hospice. That's really helpful. But things to pay attention to when kids have had a loss. What's happening at school? Is there school refusal? Trouble eating, sleeping, concentrating, physical problems. Not uncommon for kids to have things that manifest with, migraines, headaches, or GI issues. Not talking a lot about it, which means we don't know how they're interpreting it. Those are some things that we'd want to pay attention to. Withdrawing from friends, getting in trouble, some type of behavioral type issues. Those are oftentimes signs that a child may be struggling with a loss as well, along with anxieties and phobias and behavioral type outbursts. Obviously, if they're using substances, that can definitely come into play as well. So Last thing I'll mention, a couple treatment approaches that I think are really helpful for kids. Trauma-focused cognitive behavioral therapy. A lot of good research behind it, and kids that I think are struggling with, their thought process about a parent's substance use disorder, the impact that it's had, how they feel, and how that manifests behaviorally. Trauma-focused CBT is really helpful for them. A lot of good research behind it. There's a family component to it that I think is really helpful as well. Seeking safety is another one, a good integrated treatment approach for kids, especially those kids that might already be struggling with a substance use disorder or co-occurring mental health. So I just shared these with you just to maybe get you thirsty to take a look at it a little bit more. But those are programs that I've utilized and been a part of that are really helpful too. So last thing I'll mention, if folks need any more CEUs, a couple of trainings coming up that I'm involved in. The third annual Kentucky Association of Addiction Professionals Conference is coming up next month in Lexington. Also, our practice here, the offices of Paul Dalton, every year for the last 7 years, we've done an annual mental health and addiction treatment symposium in Lexington. It's October 26th this year. Got a lot of great presenters this year. Janice Gabe, who's kind of a guru with adolescent substance use, mental health, she's going to be presenting. So if anybody would like some information about these conferences, feel free to shoot me an email. Here's my contact information right here. And really appreciate your all's time. I hope this was helpful today. And I can't thank you enough for letting me be a part of it. And if there are a few minutes for questions, I'd be more than happy to answer any.
Yeah, I'm sorry, Geoff, this is Karen. That was a really great presentation. I want to reiterate what you said, that, OUD and SUD affects the whole family. And it's so important for children with parents who abuse alcohol or drugs to know it's not their fault. I could not agree more. There are a few questions. We have a few minutes. I'm going to share a link in the chat before I ask this question, because it has to do with literature for children. I'm sorry, can you all hear me now?
Yeah.
Okay, well, Geoff, to the whole conference, I apologize. I did not take myself off of mute. Thank you for that wonderful presentation. I am going to, I have a couple of questions. I'm going to drop something into the chat on a resource that Moore has used in the past, and it's a book for children. It's called Timby Talks About Addiction, and it's a great book to share with very young children. Do you have any recommendations for age-appropriate literature around addiction?
Yeah, this one right here by David Sack, How to Talk to a Child About a Parent's Addiction. That's a really good one that I encourage folks to take a look at.